Okay, I want to break down fusion a little bit for you because this is another thing that you're going to see when you're looking at pacemaker function. And actually, I want you to remember that fusion is normal pacemaker function. Okay, so if you see fusion with one of your clients or your patients, this is normal pacemaker function, and it's nothing that's going to stop the patient from going home. In fact, it's one of the things that happens because we try to promote as much intrinsic activity rather than forcing this paced activity just to reduce the progression to heart failure with some of the pacemaker patients. Okay, so what happens in fusion? Let's consider this for a second, and we'll just draw the heart, and we'll just look at the ventricle for now, knowing that yes, we do have pacemaker like atrial leads or whatever. But let's just look at the ventricle for a second, okay? And remember, if I put it in green for a second, our normal conduction system, and we put a pacemaker in because there's some dysfunction here, but again, like I said, we try and promote as much intrinsic activity. And so if there is something intact or the patient's going to get some amount of ventricular activity that's coming from the own conduction system, then that's great. And we're going to try and promote that. Okay, so green is the conduction system. And then in red, I'm just going to put in a ventricular lead. So I know it looks a little bit messy, but just consider for a second, and this is where I'm going with fusion, is we talked about the pacemaker lead being an ectopic site in the ventricle. And so we get a spike, and then we get a wide QRS complex, okay? Because of the slower depolarization of the ventricle, or the slower progression of the stimulus across the ventricle, okay? We can also get a scenario where I have, it's always too wide when I draw this, but okay, an intrinsic activity of the ventricle. But the pacemaker, because the timing interval is so tight and it just didn't see, it comes right at the same time, or it fires just as we pick it up on ECG. And so we get a pacemaker artifact, but it's followed by this normal narrow complex. It's normal and narrow, but from all the previous intrinsic activity, it's actually a beat that's coming down the green conduction system in the image here. So the pacemaker is firing, but it's meeting the cells of the ventricular myocardium that are already depolarized, so it's not having any effect. Okay, so this is a normal narrow complex and it's intrinsic. So this one is fusion. So this is V-paced, and this one is fusion. But because we're not actually affecting the QRS complex, and that is 100% the patient's own intrinsic activity, we call it pseudofusion. Okay. The other scenario, and which is why I drew that, is I want you to consider that we have pacemaker activity at the same time. Oh boy, let me draw it again. Hold on. Pacemaker activity at the same time. Okay, happening at the same time as a complex. Okay, and what is happening in this scenario is the duration of the QRS complex in this scenario is not as wide as the paced beat, but it is wider than this intrinsic beat, which is normal narrow. What's happening is you have two things working, two events working to depolarize the ventricle, and two things that then are shortening the duration of time it takes for the ventricle to depolarize. You have an ectopic site here firing at the same time as there's an intrinsic stimulus coming down from the conduction system somewhere. And so it's like having two ectopic sites. So instead of one, and the propagation of the stimulus goes out from there, we actually have, a stimulus coming down and then a stimulus firing here. And that shortens the time, because you have two things acting to depolarize all these cells. It shortens the time it takes for the whole ventricle to depolarize. Think of it as having two wave fronts working simultaneously to do the job that has to be done, which is ventricular depolarization. So it shortens the duration of just relying on the ventricular pace or just relying on the pacing lead. But because we've already started that ectopic site and it has some effect, and then we have some intrinsic activity coming down, we decrease the duration of the QRS complex in relation to this, but we're not as efficient as a purely intrinsic beat that comes from the patient's own conduction system. And this one is called true fusion. Okay, and like I said, it's normal pacemaker function. And so if you see it, it's okay, it's a good thing. We are trying to promote as much of the patient's own intrinsic activity as possible.